Welcome back to the Evolving Wellness Podcast. Today I have on Dr. Roger Seheult, who is an ICU physician, a pulmonologist, a sleep doctor, and the founder of MedCram, a YouTube channel with over 1.5 million subscribers. And he actually gets it when it comes to light. We are going to discuss how he came to this conclusion that one of the biggest things in the hospital environment that is actually contributing to illness is the light environment, and some really amazing scientific research that he has uncovered and begun to implement with his patients. So I think you're really going to enjoy this episode. Really fun, really refreshing, and lots of great information. Make sure to head down to the show notes to get all of his information and links. And I hope you enjoy the episode. If you've been listening to the show for a while, you might know that I'm not a huge fan of taking handfuls of supplements. But She Legit is something that I see in a different category, and it's something I've been playing around with for the last couple of years. Now, if you've never heard of She Legit before, it is a tar-like substance that is found in high altitudes and is heavily regarded in traditional Ayurvedic medicine for several things. When you get She Legit, you have to be careful where you source it from because you want it to be third-party tested for things like mold and heavy metals. That is why I am a huge fan of Black Lotus She Legit and their products. They're a small family company and stand behind everything they do and third-party test everything. I've personally been taking their 200 milligram She Legit tablets and absolutely feel a big difference in my energy, cognitive function, mood, and even my sleep. Check out Black Lotus She Legit and use code Sarah K to save 15% off everything on their website. A lot of people are becoming aware of the impact of minerals on our cellular hydration and energy processes of the body. They are literally indicated everywhere, and having a mineral imbalance can contribute to poor sleep, low energy, muscle cramps, and so many other problems. But what a lot of people don't understand is that taking exogenous minerals can actually cause issues. For example, adding a lot more sodium into your diet can push down your potassium levels, and adding zinc exogenously to your body can push down your copper levels, and vice versa. So, how do you know what minerals you actually need? I'm a huge fan of the upgraded formula's hair tissue mineral analysis. You can use code YOGI to save 10% on the test or anything on their site. And I highly recommend getting a consultation so someone can walk you through that test. Oftentimes, what comes back is not something that is easy to interpret on your own. But a mineral test using your hair is going to show what's been going on in your body over the last 60 to 90 days, whereas a blood test is only going to show a snapshot of time. I'm a really big fan of this hair tissue mineral analysis from Upgraded Formulas. Along with a consultation, you can get yours by following the link in the show notes and using the code YOGI for 10% off the test and consultation or anything on the Upgraded Formulas website. Hello, everybody. Welcome back to the podcast. Super excited to have on today's guest, who is just so wonderful and well spoken about light. Is the head of, is it MedCram, has 1.5 million subscribers on YouTube, and you're a working physician. That's something that doesn't happen a lot when you get into numbers like that on YouTube. They're not people who are still day to day working with patients. So I am so glad to have Dr. Roger with me here today. I don't want to mess up saying the last name. Thank you so much for being here.
Thank you so much, Sarah. It's great to be here. Yes, so I'm a pulmonary and critical care and sleep physician full time, but we also Kyle Allred and myself founded MedCram about 2012. That's when the YouTube channel started, and we have a website that does continuing medical education and lectures for healthcare professionals and anybody else that's interested as well.
I love it. Yeah. And I was just watching a ton of those videos before we sat down today. There's so much great information on there, especially about sleep. And I feel like that's such an overlooked thing when it comes to light, but maybe we can delve into all the different reasons why light and sleep are so important, the lack of light and then the right light during the day. But how did you really get interested in circadian biology and implementing these principles of light with your patients? I'm really curious about that.
Yeah, so when I became a when I became a physician, I graduated from my training. Part of what I did was sleep medicine. So from that standpoint, I was always kind of interested in circadian rhythm and understanding about how that worked, melatonin, the fact that at night, any bit of light that goes into your eyes is going to shut down melatonin. It's going to affect your circadian rhythm. That was just part of my practice. But I have to say that I didn't really quite understand the benefits of daylight and sunlight during those periods of time when you're not sleeping. So sleep, we're focused on sleep, right? But we're not sort of focused on the opposite of sleep, which is when you're awake. We don't get a lot of training on that in terms of sleep medicine. And for me, the reason why I became interested in light and what it can do to the human body, I was primed for this because of the other half of what I do, which is critical care and intensive care unit. And seeing so many patients during COVID that were so sick and dying, that really sort of opened my eyes as to what's going on here. And it was like this: when we were waiting for the wave to come, when we were seeing stuff happening in China, we were seeing stuff happening in New York, the word to us was, look, this is a respiratory disease. Get ready for people with respiratory ailments, people with COPD, people with asthma, people with lung disease. These are the people that are going to be coming in. And certainly we did see some of those people, but that was not the majority of the people that we saw. The majority of the people that we saw were people with metabolic disorders, people with heart disease, diabetes, obesity, inflammation, dementia. These are all of these diseases that are at their core really have an origin in mitochondrial dysfunction. And at the time, I didn't really understand what mitochondrial dysfunction was. I'd learned about the mitochondria in cell biology, which is what we had to take in college and obviously in medical school. But the fact that all of these were related to each other and they were related in a way that mitochondria was being damaged by oxidative stress, and oxidative stress and oxidative damage were the hallmarks of a lot of these diseases. And then I saw a paper in 2019 that was written by Scott Zimmerman and Russell Ryder, who you know, and that really just blew me away because for the first time, I started to understand that vitamin D was not the major carrier of how we got better, but it was a marker. I mean, I'd seen this in patients who were coming in. People with high vitamin D levels did relatively well. People with low vitamin D levels did not. And of course, we were
Yeah.
running around supplementing people with vitamin D, thinking that that was the end all be all, that we could somehow package the effects of the sun into a capsule. And that, that was the best we could do. And when it wasn't working as well as I thought, then I started to dig deeper. Then I started to notice that, the SARS-CoV-2 virus binds the ACE2 receptor. Well, ACE2 is involved with oxidative stress and the balancing of this oxidative stress in the body, and started to research even more. And to make a long story short, is I got interested when I started to realize that the sun, through infrared radiation, through ultraviolet light, in the right mixtures, is really perfectly designed to give us the health that we need. And when I started to even research even deeper, that simply just basically codified and confirmed what I saw. And so now I'm on this journey and this campaign to make sure people are aware of how beneficial really it is, sunlight.
Yeah. And I love so much of what you just said. I mean, there's so much to unpack there, but one of the big things that you basically just said that if people don't catch it is that light is multifaceted and it's a nutrient. There's so many facets to light. There's the lux, there's the frequency, there's, all these different factors. And the infrared, I think, is the thing that is just so extremely health promoting. And that's really what Zimmerman and Ryder were talking about in that paper was the benefits of near infrared light and that subcellular melatonin production. Am I correct about that?
Absolutely, yeah. And the fact that really this light we'd considered up to this point as just being wasted because we didn't
Mhm.
understand what it was for, and therefore getting rid of it to make these energy efficient light bulbs, to get rid of it out of the windows so that our homes didn't heat up when the sun shined through the window.
Mhm.
We've disposed of this, of literally what 53% of the photons from the sun are giving us, and felt
Mhm.
that just because we couldn't see it, we didn't need it.
Right. And that's, I always tell people, even on a rainy, cloudy day, it's so super important for you to get that out there anyway, because there's an abundance of the red and the infrared, even though there's not as much UV. it's still crucial for your metabolism hormones, and then making the subcellular melatonin that's still abundant on those days. And so don't skimp out on it just because it's not as lovely outside, right?
Right. Yeah,
Yeah.
and I think a lot of people might not understand the characteristics of near infrared light. Near
Hmm.
infrared light, how do we interact with near infrared light? If you were to go out on a sunny day, close your eyes, you would still be able to tell what side of your body the sun was on. And that's because of exactly infrared light. Infrared light penetrates your clothes. It penetrates your skin. It interacts with your body in terms of heat receptors. You're able to feel this light literally going through your clothes, your skin into your body, and it's able to bounce around inside of your body. And what it's doing is this low energy, low frequency, long wavelength energy that is being absorbed by these absorbers in your body, and it's causing them to behave differently, to do different things. And so it can go through clothes. It can go through your hat. It can go through sunscreen if you so choose to put that on. This is something that it cannot go through walls. It cannot go through
Right.
your roof. And it's not coming out of your light bulbs now,
Hmm.
unless they're incandescent still. It's not coming through your windows. And so the bottom line, and the thing that we'll say over and over again, is you actually have to go outside.
Hmm. Right. Because even if you like, people want to hack this all the time, and it's like, you can't hack this. This is something that, you could use a photobiomodulation tool, but you're going to miss out on far infrared, which has other benefits. I don't know if you've looked into Dr. Gerald Pollack's work at all, and his work with exclusion zone water, and how that far infrared expands the exclusion zone water, but you can't get that from a panel. You get that activation of cytochrome 4, but you're still missing the full spectrum, right?
Right. And the other aspect of it is that we just don't know exactly which wavelength is the best. I mean, you can turn to the
Right.
Brazil study where they did a randomized controlled trial looking at COVID-19. They used 940 nanometers. Or,
Mm.
you could look at Glenn Jeffries' work where he
I'm
looked
talking with
at
him tomorrow.
okay, Glenn Jeffrey is a great guy to talk to. So he used
Yeah.
670 in his lab looking at mitochondrial effects in terms of glucose and revving that up. So you would literally have to do that same experiment in increments, I don't know, of 5 nanometers. You could be
Hmm.
here for the next century doing all of those
Right.
experiments to figure out exactly which wavelength works in which people. And then we wouldn't even know. Maybe it's different in males and females. Maybe it's different at
Right.
different ages. I mean, it's endless. And so at the end of the day, if you really want the benefit of it, if you simply go outside, you're going to be getting all of the wavelengths packaged exactly as they're supposed to be. Of
Right.
course, now we can talk about people that, can't go outside, people that are hooked up to ventilators. Although I would say, if we really want to get those people outside, we could find a way to do that.
Yeah. Didn't you have I think I heard you talking with Meredith at the Quantum Biology Collective about a patient you had. Was it during 2019, 2020 that you were able to get outside that
It
had
was it
COVID?
was actually, and as I was mentioning, it was actually really just recently, about a year ago,
Mm.
and really I didn't sort of understand everything that I understand now. It was a process going through COVID. At first, I was very gung ho on supplementing with vitamin D. I still think it's reasonable to do so, but I'm now realizing that it really was the sunlight that was doing a lot of the benefit based on studies and also my personal experience. So when this happened, by the time I realized this, most of the patients had sort of cycled through the ICU, and I wasn't seeing as many people getting sick enough to actually get to the ICU. However, a year ago, I had a patient was asked to go see on the floor, 35 liters, 100% FiO2, 100% oxygen. Had been there for 2 days, getting worse despite standard of care, which was steroids, antibiotics, things of that nature.
Mm.
And boy, I said, we need to get you outside. And we had the respiratory therapist, we had the charge nurse. We worked together to get this guy into a wheelchair, hooked him up to 2 oxygen tanks, got him outside for 20 to 30 minutes every day. I
Mm.
think you probably just need 15 minutes, but I didn't want to undercut him. So I just said, hey, since she's out there, just go give him 30 minutes of light. And within 5 days, he was home off oxygen. Now, it's an anecdotal story. I can't prove to you that that's what saved him. But boy, every single time I do this, the anecdotal story is that they get better. And
Yeah.
but that was a remarkable case. I haven't seen a patient with COVID-19 so severe that they were, you know, requiring intubation. Hopefully, we would try to get this before that. But the problem is that many people are inside nowadays. They don't go outside, and I think that sunlight could actually have a big benefit.
Yeah, and that's something I talk about a lot just in my community is that, so many people are focused on nutrition. And I do think that you're not in a position where you can just eat crap and eat whatever
Yeah,
you want, eat the ultra processed foods. But the thing that a lot of people are ignoring is their light environment. And I think we can dive into the implications of disrupted circadian rhythms. Uh, and then, kind of on the wavelength that we're talking about is this lack of infrared, the lack of sunlight exposure during the day. I think
yeah,
I was listening to the episode you did with Dr. Max, where you talked about the study in Louisville, and it was just
yeah,
uh, exposure to green trees. Maybe we could talk about that a little bit because I think people get so myopic
yeah.
about things.
So we talked about the characteristics of infrared light being that it can penetrate very deeply through things and that it can penetrate through your clothes. There is an extra aspect to infrared light, and that is that it bounces off of leaves and trees very, very easily. The leaves and the trees do absorb red and blue light, which they need for photosynthesis. That's in the visible spectrum. And the complementary color to that is green. That's why they appear green. But
Mhm.
outside of the visible spectrum, these leaves and trees, they highly, highly reflect infrared light, such that if you're in an environment where there's a lot of leaves and trees, you can get almost double the amount of infrared light that you would get normally otherwise. So
Mhm.
lots of infrared light in a green tree environment. And we've known for decades that people who grow up, who live in green in spaces have less diabetes, they have less cardiovascular disease, less mortality. They even have less preterm labor. Speaking about,
Wow.
antepartum benefits of health there too. For
Yep.
many years, though, there's been naysayers that have said, well, people who are also more, upwardly mobile, socioeconomically improved, they also tend to live in green spaces, and maybe we're just seeing the results of that. So this study was done. I love this study because it just completely silenced those naysayers, because they
Yeah.
went to a area, 4 square mile area in South Louisville, Kentucky, and they basically measured everyone's CRP. So, highly sensitive CRP is a surrogate marker for inflammation of the blood vessels. It's predictive of stroke, it's predictive of cardiovascular disease. And small changes in CRP can actually have dramatic effects. For instance, exercise, regular exercise 3 times a week, which is very important, can drop the CRP levels by anywhere from 10 to 15%. So that's a good marker. So they went around and they planted about 9,000 mature leafy trees in this 4 square mile area. And then they went back about 2 to 3 years later and they remeasured highly sensitive CRP levels in the same population. So they did not, make them upwardly mobile. They did not tell them to exercise. They did not give them better homes or better paychecks. So none of those
Mhm.
changed. And yet, highly sensitive CRP levels across that population dropped by 13%, which is huge. And
Wow.
it shows that the actual fact that the trees are there are making an impression. So what's probably happening is that people are going outside the same amount, but they're getting a lot more infrared light, and that's
Mhm.
improving the oxidative stress situation in their mitochondria. Probably a host of other things that we don't understand. We can't simplify it that much. There's probably a lot of things going on. These trees, by the way, they give off phytoncides, which are chemicals that actually improve our immune system. That's been shown multiple times in studies that have been done, especially in Japan with Hinoki cypress trees. It's known as forest bathing. Well written down and well documented. But yeah, so getting outside in a green environment is really, really important.
Wow. I love it. And I think that's so empowering for people because there's trees here where I live. I'm in the city, I'm in Atlanta, and we've got all kinds of urban noise and things that are a little bit irritating, but we do have tons of trees here. And
Yeah,
there are so many studies that show also this reduction in serum cortisol levels just from
correct.
being around trees. So there's all across the board health benefits, and people that want to get benefits of sunlight, they want to get that subcellular melatonin production, which
Yeah.
kind of helps to clean things up during the day, really. if you're in an environment with a lot of green trees, you're just soaking that in, and it's so health promoting.
Yeah, I just can't help but think of that study that was just recently published, probably 2 months ago, out of the
Mhm.
University of Texas, where they used UK biobank data. And they
Mhm.
answered this very question where they looked to see when light was a benefit and when light turned into a liability. So up to this point, you're talking about urban sprawl. The Chinese published a study where they looked at satellite photographs of light based on a geography. And they were able to take people in those geographies and actually correlate that excessive light at night, so basically bright nights,
Mhm.
correlated to a higher mortality in those geographic regions. So
Mhm.
this study that I'm referring to, the one where the University of Texas researchers looked at UK biobank data, they didn't look at satellite photos, but they actually had them wear a watch with a light sensor. Now, this was not looking at infrared light particularly, just light in general, probably in the visible spectrum. Although I would love to see a study repeated that actually had an infrared light sensor. That would be really incredible.
Yeah.
So what they did was this was about 80,000 subjects. They measured the amount of light that was coming into the watch. They did it for about a week. They remeasured it in a subset, and they found that it was actually very representative of the amount of light that they were getting. And then what they did was they graphed it on a circadian rhythm time scale, starting at about 4 o'clock in the afternoon and going all the way through till 4 o'clock the next day. And what they did was they looked at mortality rates over about 8 years. And specifically, they took those people who had from the 0 to 50th percentile of light coming in at any particular hour. And that was the baseline. And then what they did was they looked at people from 50 to 70, from 70 to 90, and then from 90 to 100. So they looked at a dose response. And what they found was, sure enough, as they went up from 50 to 70 to 80 to 90 to 100, that the differences in mortality got bigger and bigger and bigger. That's important to understand because we're talking that this is kind of like a correlative study, correlation.
Mhm.
Correlation doesn't necessarily mean causation. That is
Right.
true, except when you see a dose response curve. When you see a dose response curve, that is highly suggestive of a causal relationship. This is exactly how we figured out, by the way, that smoking causes lung cancer. We didn't do a randomized controlled trial.
Right.
We did these correlation studies and it showed a dose response curve. So what did it show? What was the benefit of light or the detriment of light? What it showed was that light any time of day was a benefit, except when you hit around 9 o'clock, 10 o'clock at night. Then it started to go from a
Mhm.
benefit in terms of reducing mortality. And then it actually became positive at around midnight.
Wow.
Then it stayed up as a positive. That means any kind of light exposure after midnight was correlated to increased mortality. And then it only dropped down at about 6 or 7 o'clock in the morning and then became very quickly a negative.
Wow.
That was really an amazing. I'd never seen before a study that literally showed you hour by hour how light can actually change the mechanics of your body to the point that it actually can cause you to die sooner or
Wow.
cause you to survive longer. That was incredible.
Fascinating. That's fascinating. Yeah, I love looking at things like this because it's a simple thing and you don't have to have like a ridiculous amount of money. You don't have to buy a bunch of biohacking tools. You don't have to do a bunch of special diets. It's just something that you can change at home. And I think that the artificial light at night is such a mitochondrial toxin for people
Yeah.
and is causing, we just got through October, which is Breast Cancer Awareness Month. And it's like we have all the pink ribbons and we talk about all these other things that prevent breast cancer, but I'm still not really hearing a very loud conversation about artificial light at night and breast cancer. And when you look at the research on hormonal cancers, just in general, we go prostate, breast, ovarian, all of these, the correlation between these cancer incidences and artificial light at night is huge. It skyrockets, and yeah, we're still not getting getting
Yeah.
it as a population. A lot of people are quick to talk about the benefits of sunlight, but what gets often missed in the conversation is the benefit of darkness and the importance of protecting yourself from blue and green light after sunset. That is why I choose Viva Rays as my go-to source for protecting my circadian rhythms. You can use the code YOGI to save 15% off at Viva Rays. Now, you may have seen some of these studies popping up. I call them fear mongering about blue blockers not being effective. And that is a partial truth because when you use blue blockers that are clear or that have not been tested with a spectrometer to actually block what they say they do, they will not protect your circadian rhythms and they are not catching those key wavelengths that you need to be blocking in order for your body to be able to repair, for you to make melatonin, which is a master antioxidant. And artificial light at night has been in the scientific literature extensively linked to a host of hormonal cancers, obesity, diabetes, and all sorts of metabolic issues. That again is why I choose Viva Rays as my go-to source for protecting my circadian rhythms to allow my body to get adequate darkness at night. You can use the code YOGI to save 15% over at Viva Rays, and you can actually trust that they block the frequencies of light that they say they do. Thanks to Viva Rays for sponsoring today's podcast.
So, and then this could be very concerning to people who do night shift work. So I do night shift work,
Yes.
and so it's very concerning to me because I have to do
Yeah.
it sometimes because, I'm critical care and no one else
For
is
an
going to be
ICU
there. Patients are
doctor.
going to die.
Right.
Yeah.
Right.
And so what was interesting about this study was they asked the question, well, they didn't ask the question, but they actually ended up answering the question. What is more important, getting daytime sunlight
Mm-hmm.
or light, or avoiding nighttime light? And when they pushed the limits of the study, when they started to account for gender, age, all of these things in the subgroup analysis, what started to happen was the amplitude of the mortality started to decrease, which meant that there was some confounders that were amplifying this effect. And when you
Mm-hmm.
finally got down to what they called Model 3, which took into consideration all of these things, yes, at the 90th to 100th percentile, compared to those at the 50th and below, there was still a statistical significant increase in mortality at night if you had light, and a statistically significant reduction um, after night during the day. If you got sun, it was reducing it. But once you
Mm-hmm.
got down to about 50 to 70th percentile, so in other words, if you were getting 50th to 70th percentile for light at night and 50th to 70th percentile for light during the day, right? That just means you're getting above the average person.
Mm-hmm.
Okay, the average person in the study. What they found was that 50th to 70th percentile of light at night did increase it numerically, the amount of mortality at night, but it was not statistically significant. However, when you looked at the reduction in mortality during the day from 50th to 70th percentile light exposure, it still was statistically significant. So the way I interpret that is that both are important, but what's most
Mm-hmm.
important is making sure that you're getting light during the day. And
Mm-hmm.
that's the thing that is so hard to get,
If you're
especially
doing
in the
night
northern
shift.
hemisphere this time of year
Mm-hmm.
when the sun is rising after you go off to work and setting
Mm-hmm.
before you have time to get to your car and get
Mm-hmm.
home.
Yep. And I think that's why we see so much obesity, depression, anxiety. It's like you have to figure out a way to be more strategic around
Yeah.
this time of year. And I think you mentioned a statistic about the longest or the shortest day of the year and
Yeah.
the a spiking of all kinds of infections, flu, all these things happen, spike around that a week after the shortest day
Yeah.
of the year. And then they go down after the longest day of the year to like, their
The
lowest.
lowest. Yeah.
Yeah. Yeah. Yeah. Yeah. So maybe we can
Yeah,
talk about
so there's,
that.
yeah, you can look at the data on this. I saw this chart. The chart was actually constructed to demonstrate the effect of COVID in terms of the amount of deaths, but they sort of laid down there about 5 years prior, and it was stunning when you looked at
Mhm.
the pattern. It wasn't just lung infections. It wasn't just pneumonia. It wasn't just influenza. It was kidney disease, heart disease, dementia, Alzheimer's disease. All of these major natural causes of death, they all went up and peaked literally right in late December, early January. and then they all
Wow.
dropped off through the year, and then they reached their minimum right after mid-June to late June, July. In fact, the only thing that actually went up in July was accidents, right? That's not a natural cause of death, but nevertheless. So all of these things, kidney disease, heart disease, dementia, all of these things that we talked about already that really have the mitochondria as their basis for the most
Mm-hmm.
part,
Mm-hmm.
they all have this cyclic pattern that is completely dependent on the sun. If we look at Australia, it's the
Mm-hmm.
exact opposite. Of course, it's still, the highest in the wintertime, but of course their wintertime is in July.
Right.
There was a study that was done at the Harvard Kennedy School. This is not a medical school. This is the political policy school that
Mm.
was founded actually by John F. Kennedy. And they looked at CDC data for influenza, and they looked at the amount of light hitting specific regions of the United States. And they
Mm.
put those two together. And what really helped was the 2009 H1N1 pandemic, because
Mm.
as we know, most flus are peaking in the wintertime. So it's hard to
Mhm.
get differences about how that might affect it. But with the H1N1 2009 pandemic that we had across the world, there was people that were getting, the flu all throughout the year of that year because of that pandemic. And
Mm.
that really helped out because what the researchers were able to find, and this is what they said, quote, they said, we find that sunlight strongly protects against getting influenza. They actually showed that it
Wow.
correlated in many of the analysis that they did. They even looked at different states. They looked at the entire country and they looked at the city of New York or the state of New York. And in both of those situations, in every situation that they did an analysis, more sunlight in a particular area meant a reduction in influenza.
Wow. That's so fascinating. And, I think that there's also a hormonal aspect to all of this as well. When we look at light, look at cortisol and melatonin patterns, because we just had the time change, unless you're in Arizona, one of these places
Yeah.
where they do this ridiculous thing to people. And I was looking at the data to do a post on Instagram, which it upset an ungodly amount of people that I just literally posted this. People got really mad. Um, that I guess it's the Monday following the time change in the spring when daylight saving time starts, there's a 24% increase in heart attacks that following Monday. But the Tuesday following the end of daylight saving time in the fall, like we just had, there's a 21% decrease in heart attacks on that
Yeah.
Tuesday. And then I
Yeah.
wrote, please tell me again how light doesn't impact your health. And then everyone was on the keyboard mad about it. But
They were mad that you were saying that light does impact health?
yeah, I said, please tell me again how light does not impact your health, like just posing
Yeah.
the question. And yeah, it was apparently a very triggering post for people. I don't
Well,
know.
it's true when people need to wake up and see the
Yeah.
data. The data speaks for itself.
Yeah.
I mean, yeah,
Yeah.
it,
Yeah. And
it's true.
there's the chain, like I said, I think there's so many aspects of it. There's the infrared exposure. We're getting so much more of it in the summer. Like you said, that's going to help with the immune system, the mitochondria. And then in the winter, we're getting so much less of it. And I think a huge issue, I talk about this with my colleagues all the time, is that, winter is really this time where we're supposed to it's like melatonin season, right? And that means getting enough infrared during the day to max out your subcellular melatonin as much as you can
Yeah.
and not avoiding the outdoors because it's gross. And then at nighttime, really being mindful. It's 6:30 here. I've got my blue blockers on because the sun went down an hour ago. I had to. I made a special arrangement because I really wanted to bring you on for my community, but I think in
Yeah.
wintertime, we really have to preserve melatonin, make melatonin, because I don't know if you've looked at some of the research on melatonin essentially docking to the vitamin D receptor and kind of the
Wow.
implications of that at all. I don't know if you've looked at that
No,
at
that's I have to look at that. Again, I'm not surprised. We try to make things very simplified and,
all.
you go out to the sun, you get vitamin D, it's good for your bones. No, it's true, but it's actually a lot more complicated
So
than
much
that
more.
and
Yeah,
probably even more complicated than we actually imagine.
right. Right.
Yeah.
That's why, a researcher that I had on recently, his wife was diagnosed with osteoporosis and they were just pounding the vitamin D supplements with her. And she actually got deathly ill from all the vitamin D. And then he,
Wow.
started diving into vitamin D and how it could be toxic when people are
Sure.
overdoing it the way they're doing it and ignoring sun exposure. So, yeah, we always think that we're so smart as humans and that we can just take an ancillary hormone or subtract the chemical makeup of vitamin A or vitamin E
Yeah.
and the body's going to react the same exact way, and it just doesn't work that way.
Well, yeah, and I think the best example of that is what they thought, years ago when they saw lung cancer patients with diets high in vitamin E and vitamin A, beta carotene, and so they decided, hey, well, let's give them high doses of this. Well, when they did, actually it turned out worse. Actually, it was more detrimental. And it's this
Wow.
reductionism that we see where we think that if something's good, there must be something in there that's doing the heavy lifting. And we don't look at the gestalt of it, where we see that maybe these things that are together in a certain formula, a certain ratio, is really what's going on,
Yeah,
and that's
absolutely.
beneficial just as it is.
Absolutely. So many places I want to go with this, but one thing I want to make sure I don't miss because this is a question that I get, and you mentioned it probably under every video I talk about light. You mentioned working the night shift. And so,
Yeah,
what I kind of gathered from what you said is that it's important that you're getting sunlight during the day. But how do you manage that from a perspective of, being somebody that has to be in a hospital environment where there are terrible lights, all the LEDs, fluorescence, and uh,
yeah.
not a really great environment? How do you manage that knowing what you know?
Yeah, it's difficult. And because a lot of the things that you need to do, you have to be having an employer that's willing to do some of that stuff for you. I would say this, though, that if you are chronically a night shift person, then you really want to flip your circadian rhythm around so that your day is night and your night is day. Meaning that if you're working at night, that's when you should be doing all the same stuff that someone normally in the day should be having. So bright lights, making sure that that's when you're eating, and that when you go home and it's now your night, you should be sleeping in a room, even though the sun is up, you should be sleeping in a room that has the blinds closed, that there's no light coming in, that you're sleeping, you're anchoring your circadian rhythm in that situation, and really doing what you need to do to make sure that you're getting that appropriate sleep. That should satisfy just about everything in terms of circadian rhythm, except for the fact that now at night in your place of work, you're not going to be getting incandescent light bulbs
Right.
giving you that near infrared light. It's going to be LED bulbs. It's going to be, fluorescent bulbs. And so I can see how it might be beneficial, for instance, if you're on a break, where I would normally tell people in the day when they're inside to go outside for a lunch break and get as much sunlight as they possibly can for 15 or 20 minutes, depending on your break. This may be where, you've got an infrared panel that you sort of sit in front for 15 minutes if you have to do that at night, and try to get as much of the benefit as possible. I'd also say that on the weekends when you're not working, or those days that you're not working, it's really important to continue that circadian rhythm even on the days that you're not working. Otherwise, it's going to become confused. And we have data that shows that just disruption of your circadian rhythm for just one 24-hour period can really cause havoc with over 150 different proteins that are related to metabolism, diabetes, the immune system, even fighting cancer.
Yeah. And I get a lot of people that come to me, they're like, I'm on night shift. I don't know how to manage this. And those are the people I push a little bit more into doing a little bit more fasting, a little bit more ketosis,
Yeah.
really having to use those Zeitgeibers of food as secondary signals, maybe doing some cold face plunging to signal morning, a warm bath to signal evening. But
Yeah.
yeah, it's definitely challenging for sure.
Yes, yeah. So fasting is great. It's intermittent fasting, ketosis, just making sure that those things are timed with when
Mhm.
it is that you're going to sleep, so that 4 to 5 hours before you're going to go to sleep, you've already gotten rid of all the carbohydrates and the things that would turn off those types of genes that are for rest and repair.
Let's talk about that because that's another post I just did the other day that really upset people. I don't try to upset people. I do want to kind of wake them up and push buttons a little bit. But there was a study I uncovered that essentially showed, I think it was like a 48% increase in colorectal cancer. It was a data study, nutritional data study. So they were reporting it, right? But the people that had this 48% increase in colorectal cancer were eating 3 hours before bed and sooner, right? And those were the people that saw the most incidences of cancer, essentially. And the study actually concluded that it was because they were eating so close to bed that it was throwing off their circadian rhythm and destroying their melatonin production. And that also was disrupting the GI process because our gut, of course, runs on a circadian rhythm, and it's supposed to be making less stomach acid, less digestive function available at that time. And so, yeah, that was upsetting
Yeah.
to people. But what you just said about ketosis, maybe beta oxidation, and understanding that, because that's another thing I always try to tell people. If you want to optimize your health, you really do need to try to stop eating 3, 4 hours. I like 4 hours before bed, in addition to doing the light protocols. But maybe as a sleep doctor, people will listen to you a little more than
Yeah,
me.
so you're absolutely right. You need to stop eating calories about 4 or 5 hours perhaps before you lay down. So remember that, and I like to use this analogy because I think it works so well. I used to have a friend in high school that used to work at Disneyland, and but he
Mm.
did not work in the day. He worked at night, and he was there part of the cleanup crew, and all sorts of things happen at Disneyland at night that you have no idea about. The engineers are shutting down Space Mountain to make sure that it's working correctly. They are cleaning out the cash registers. They are restocking the gift shop. They are digging the weeds out of the garden. They are sweeping the streets. They're doing all of this stuff so that, 8 o'clock the next morning, Disneyland opens like it's a brand new park and it's ready to go. So all of these processes are individual processes that have specific jobs, but they're all happening at the same time. And the reason why they're all happening at the same time is because they can't do it during the day, because that's when the guests are there. That's when they're lining up, and they don't want to have any of this stuff happening in the foreground. Our body is far more complex than Disneyland, and there's a whole host of things that need to get done. The milieu, the environment that happens in, where there is breaking down, where there is targeting structures that are not working correctly and breaking them down, cells that may have damaged DNA, breaking them down and putting them into their building material so that the next cycle they can be built back up, is really important if you want to avoid disease. And so when people have diseases, that to me is a situation where you have not taken the opportunity enough to allow your body to break this stuff down and to allow it to be rebuilt back. So when does that happen? That happens when you're sleeping. Sleep allows the body to recover, to regenerate something that happens that you expend during the day to allow you to do the next day. So one of the major signals for rest and repair is beta hydroxybutyrate. Beta hydroxybutyrate is not just a marker of ketosis, it is also a major inducer of a whole host of genes and processes that allow the body to do that breaking down. So imagine if you have these two processes, which is sleep, which is tremendously restorative if it's done correctly, and you have this beta hydroxybutyrate. These two things should be coming on at exactly the same time. If they're not coming on at the same time, if one is staggered, if you're eating a meal right before you lay down, that food has got to process through its body 4 to 5 hours, and then that's when beta hydroxybutyrate comes online. Well, if you're sleeping 5 or 6 hours, you're not getting the benefit of that until the last hour of your sleep, maybe not at all. And so you're
Mhm.
not coordinating this. That's kind of like the gardener coming in at, midnight when the park closes and the engineers coming in at 4 or 5 o'clock in the morning, right? You're not gonna get the maximal benefit. You may have to shut down Space Mountain that day because the engineers didn't do their job and there was a malfunction during the day. And so now that attraction is closed, right? So Disneyland is not 100% that day. And just like you,
Mm.
if you're not getting the maximum amount of sleep, you're not coordinating it with intermittent fasting, you're going to have a problem. I'll just say, when I first heard about intermittent fasting, I don't know why I didn't put two and two together, but I thought, oh, great. I'm a physician. I come home from work. My kids are there. My wife is there. This is a great time to socialize. It's going to be much easier for me to skip breakfast than it is for me
Yes.
to skip dinner, right? And I
I
see this
love this
so,
conversation.
yeah, and we see this all the time, and it
Yes.
doesn't work as well. It doesn't
Nope.
work as well.
Nope. Nope.
You're swimming upriver. You're trying to
That,
swim and you're swimming upriver. It's much better to just go along with literally what is implanted in our circadian rhythm. So the fact of
yeah.
the matter is, this is a unchangeable, hardwired fact that the body is much more sensitive to insulin in the morning time than it is in the
Hmm.
evening time. So you can
Yep.
eat the same calories in the morning time and your blood sugar is going to go up a certain amount. You eat those same calories in the evening time, it goes up a higher amount. Your body needs
Hmm.
more insulin to process calories in the evening. That's just a fact of
Yep.
circadian rhythm, and you cannot change it. It's hardwired.
Yep. One of my favorite studies I've been referring to a lot these days, because that's another one you put that out there online and people get very upset. They're like, I'm not a breakfast person. I would
Yeah,
never eat breakfast. I'm like, well, if you're dealing with a cortisol issue, sleep issue, hormone issue, you have to change that up because food's a zeitgeber. You've got to reinforce that. You've
absolutely.
got to stabilize your blood sugar. You've got to support your adrenals. And the study that I keep referring to on my Instagram is that this group of perimenopausal women, because that, being a 45-year-old woman, it can be harder for you to uh, maintain your physique. But the study showed that these perimenopausal women were put all on the same exact amount of calories, same exact amount of calories. They were all in a calorie deficit. And the women who ate the big breakfast and the small dinner lost actually significantly more weight than the women who ate the small breakfast and the really big dinner, had a lowered waist circumference, lowered triglycerides, lowered fasting insulin, like across the board metabolic markers were greatly improved with the women over the women who ate the big dinner and the small breakfast. And it's just, I mean, it makes perfect sense to me, but people have to kind of hear it in those
You
terms
gotta
before they
you gotta
understand.
send me that study. I haven't
I
seen that study,
will.
but that's a great study.
I will. Yeah. I refer to it all the time when people say it doesn't matter what time you eat. It just matters how many calories you eat. I'm like,
I can
incorrect.
pretty much tell you this, Sarah. If anybody starts a sentence by saying it doesn't matter what time the, the answer's probably going to be wrong.
Wrong.
We
Wrong.
it's so impressive now. Even the entire world of pharmacology, just to understand where we are right now, is the entire world of pharmacology is now second guessing all of the studies that they've done in the past because they never controlled for circadian rhythm. And what they're finding out is that our metabolism is so different at different times of the day that there literally might actually be a appropriate time to take a certain medication if you want to limit the side effects and maximize the efficacy of that medication. Just to
I
just
mean,
to just to put that out there.
that makes perfect sense. I mean, that's
Yeah.
why it's like the thyroid medication, you're supposed to take that in the morning. And then when you look at UVA and how that impacts the thyroid, the morning UVA is that's when the thyroid gets activated in the morning. And we start making pregnenolone that gets shuttled to cortisol and the sex steroid hormone pathway that comes online in the morning. And there's so many of these, like
Yeah.
every single cell and organ system in your body has this circadian clock in front of it. And you can't ignore it when it comes to your health. So that's, yeah,
Yeah.
it's fascinating. I've heard them doing that with even like chemotherapy. Is that correct?
Chemotherapy, blood pressure medications, we are starting to the world of circadian rhythm is opening up. And
Yeah.
now the other aspect I wanted to mention to you, you may have people that really truly have a hard time eating in the morning and they're just
Mm-hmm.
ravenous in the evening, and they just
Mm-hmm.
might think that that's hardwired into them. But the point of it is that it's a learned experience. Hunger is a learned experience, and
Mm-hmm.
if people decide that they are going to consciously cut down on the size of their meal in the evening and consciously increase the size of their meal in the morning over a period of time, you will not have hunger in the evening and satiety in the morning. You will actually adapt to that because that's what your body experiences. So people sometimes confuse the feeling of hunger for lack of energy. That's not the case. You can have plenty of energy circulating around in your body, but still feel hungry. Hungry is a learned response. It is a homeostasis response that can be changed and relearned.
I love that. And people get upset when you say that, but it's like you can train your body to eat 6 times a day, and then you're going to be hungry 6 times a day. You can train your body to
Yes.
eat 2 to 3 times a day, which is what I recommend. I don't like people doing one meal a day all the time. I think that can
Yeah.
kind of down regulate things and create a stress response. But you're always training your body from the light environment to the food, because food's a zeitgeber, to socialization, to all these
Yep.
things are training that circadian system. So
Yep.
you have to understand you have more power than you think you do, just because you're not a
Yeah, and there
breakfast.
was right, and there was a study that I saw, and I'm trying to remember exactly where I saw it, but it was based on intermittent fasting, and what they showed was the effectiveness or the expression of clock genes in the circadian rhythm was changed just by changing when you ate. Just to sort of bolster what you're saying there, that food is a zeitgeber, something that influences the circadian rhythm.
Yep. Yeah, it's fascinating. And I get this question a lot. So I know I would love to hear your response to it. People will often come to me and say, I can't sleep without that bedtime snack. I've got to have my bedtime snack. And, I always say that means your metabolism as a whole, your system as a whole needs more support. We need to help you nutritionally to do that, and maybe make different choices and do some metabolic training to get you able to do that. But eventually we do want to try to pull that away. What do you say in that situation to the person that says, I can't fall asleep unless I have food, as someone who is a sleep doctor?
Yeah, there's no pharmacological or pathophysiological reason why that would be the case.
Mm,
A lot of times there are many diseases or many conditions and diseases which are um, perpetuated and yeah, perpetuated, I think is the best term there, by our mind. Our minds
mm,
perpetuate a lot of the things that we feel in our bodies. And certainly when it comes to hunger, when it comes to eating, these are things that are governed not just by homeostasis, but also by impulsivity, by the basal ganglia, the
mm.
limbic system, all sorts of things that means that there's sort of a supertentorial or more of a psychological aspect to a lot of this as well.
Absolutely. Yeah, I think it's multifaceted, and it's something that, like, you have to metabolically train someone to be able to do that, because like you said, you want them to be able to have that chance to get into fat burning, to get into ketosis. And that doesn't mean everyone, well, I won't speak for you, but I don't think everyone needs to be on a ketogenic diet.
No,
I don't think
no.
that's necessarily the best thing for everyone, honestly, but you want your body to be able to go into ketosis when you're sleeping, correct?
Yeah, so I agree with you. This is not a one size fits all. There are certainly people that have certain conditions that they need to, discuss it with their healthcare provider because they may have malnourishment, they may have all sorts of things. But what we're talking about here is generally, there's certainly some people that may need to have 3 meals a day every day without exception. And
Mm,
there's certainly some people that could probably get away with just 2 meals a day and
mm,
have that last meal sort of later in the afternoon if they can.
mm,
And then nothing after 5:30. I had a patient that was referred to me for long COVID, shortness of breath, had it for 3 years, couldn't get rid of it. We checked everything. I made two very simple changes. I said, don't eat anything after 5:30, and I described to him my whole discussion about, my friend at Disneyland and how the
mm,
body needs to rest and repair, how things needed to be degraded in his body and built back up again, and told him to get outside. So literally the only things I told him was to get sunshine 20 to 30 minutes a day and to not
mm.
eat anything after 5:30 at night. Those are the only two things that I told him to do, and he did it religiously. 3 weeks
Wow.
later, he came back. He said his shortness of breath, which was 8 out of 10, was now 2 out of 10. It didn't even bother him anymore. He didn't even need to take his gastroesophageal reflux disease medication because the reflux that he was experiencing every night, likely because he was eating late, was causing him not to sleep well. Causing him not to sleep well was causing his body not to regenerate. And all of these things basically got better, and I could discharge him from the clinic just with those two simple, basically very inexpensive interventions.
Yeah. I love that. I love a doctor that's giving this sort of advice. That's why one of the reasons I wanted to bring you on, because I don't hear this from a lot of people. It's like it's like, it doesn't matter what you eat. Your diet doesn't matter when you eat. I'm not hearing doctors give this sort of advice to patients. So it's super refreshing to hear that you're not only doing it, but it's working for people. So giving people
I
hope that they can try this.
Yeah, and I didn't, and here's hope. Just because a doctor's not doing it doesn't mean he can't be convinced, because I was just
Mm,
like them. I didn't
yeah.
understand all of this stuff fully. And again, when COVID came, it caused me to really investigate and to look, and I'm starting to see. I'm still open-minded, still willing to learn. But boy, there's been some truths that have been laid out, and certainly these are the things that we should really be emphasizing to patients, because there's really hardly any side effects to these things.
Yeah. It's just so tough. It's like, how do we change, the inside of the system? Because my daughter was unfortunately in the ICU, not this past August, but the August before last, for a week, and it was just a horrible environment having to be there for the week. It's like, and you
Yeah.
start to feel bad for everybody that works there. And then they wanted to keep her in the hospital for longer to try out this other medication. And my husband and I were like, no, we're going to deny that. We have to get her home. Like, we have to get her outside. We have to get her out of
Yes.
here. And she got better when we got home. It took some time, but she started getting better when we got home. Cause I'm like, she was worsening in the hospital. I'm like, this has something to do with all these lights. Like, cause I already knew what I knew. I'm like, we have to get her out of here. And it's like, as soon as we were able to get her outside, get her at home, grounded out in the sun, she started getting better. And it's tough because you and I are just two people. And
Yeah.
how
Well,
how do we
I may be a one-man campaign. I'm not one man. There's many people that have been talking about this before I was even talking about it. And let's be quite honest. Over 100 years ago, people
Mhm.
like
Oh
Florence
yes.
Nightingale were talking about what she saw. I mean, she was a nurse there right at the bedside. She came from a very reputable family that didn't want her to go into nursing. Nursing was not really what it was today. It's kind of a
Mhm.
disrespectful profession back then. She really elevated it. She founded modern nursing, and she really cared for her patients, was at their bedside. And she clearly, she said that, look, the number one thing that seems to help patients the most is fresh air. Number two, close second, is direct sunlight. And these and other health reformers, Ellen G. White is another one in the late 1870s. Interestingly, she said both. She said, "Look, you need to get outside in the sun." And interestingly, what she said, and I found this uh, based on what our discussion really interesting, is that she said, "Look, after 9 o'clock, turn out the lights."
Mhm.
This turning night into day, she said, is a health is a wretched health destroying habit. She said that back in early 1900s, before we even had
Wow.
electricity widely available. People were using gas
Right.
lamps at the time, kerosene lamps. But she
Right.
even saw
Which are
then.
less of an issue. Yeah.
Yeah, yeah. I mean,
Yeah.
and you're probably getting a wider spectrum, but even then, she was noticing that. So I've turned into a campaign of saying, you know what, we ought to get our patients in the hospital outside.
Mhm.
Your story reminded me of a story that was told to me last week
Mhm.
of a mother who had her 15-year-old son in the intensive care unit as well.
Mhm.
Her name is Sarah Hunmeyer, and she gives me permission to tell this story. She's actually also recently joined our campaign of internet of influencers here to get people out in the sun. She didn't know it at the time, but her story is um, very compelling, and I highly recommend maybe even talking to her. So
Yeah.
what happened was is that her son, who was 15 years old, developed B-cell lymphoma. This was back in September of 2023, And he went on chemotherapy as a result of that. And in about May of this year, at the end of May of 2024, he developed cough, shortness of breath, and had to be hospitalized. He had a fever, elevated neutrophil count, or actually low neutrophil count. And it was turned after about a week or two in the hospital, they finally got the culture results back showing a fungus that was flesh eating. A mucor is the other name for it, and it was basically highly involved in his right lung, his left lung, and he basically had to get his lung removed. It was that bad for him to survive. After that, he continued to be hospitalized, getting very powerful antifungal therapy, amphotericin B, posaconazole. These are very powerful antifungal medications, but he kept getting worse. His white count was going up, his oxygen requirement was going up, he was becoming more short of breath, perfectly with it, perfectly able to comprehend what was going on, and started to end up on a non-invasive breathing machine called BiPAP, where the high oxygen requirements were there. And the hospital staff at that point, the physicians, the infectious disease specialists, the thoracic surgeon, the oncologist, they were very concerned about the direction that he was heading and the fact that if he were to get on a ventilator, they didn't think he was going to get off. So they had a conference and they discussed with the parents and they mentioned this to them, and it was just devastating, as you can imagine, that he was getting worse and there was really nothing else they could do. They had to actually try to explain this to him because he was perfectly with it. And it was told to him that he had basically had 2 days to live. So you can imagine your 15-year-old is there on a breathing machine. Already one lung is gone. This fungus has got into the other lung. It's making progress. It's getting worse. He's on a breathing machine. He can't really talk. And the staff, of course, felt terrible. They were doing everything in their power that they knew how to do. They were highly skilled. This was at a university hospital in Minnesota in the middle of July. Now it's been 6 weeks since he's been in the hospital, not being outside. And this kid, you know, bless his heart, he wasn't one that, his dying wish was to play video games. His dying wish was to get outside. And actually, ironically, it was because of that dying wish to get outside that his life was saved. Because as soon as he went outside, into the sunlight for 3 or 4 hours. And trust me, the staff, it was very difficult to get him outside because of all the oxygen requirements that he had, the fact that it was unsafe, kind of a liability. The reason why he got outside was because the hospital staff had realized that, he was going to die anyway. So just give him his last wish. Well, he didn't die. He got better. His oxygen requirements improved dramatically. In fact, his mom's Amy sent me the CT scan of the one that they had done after 5 days of him being outside. And there was a dramatic, radical difference between these two, such to the fact that the doctors were completely stunned. They didn't understand what was happening, but they took this opportunity to get him back on his chemotherapy. Bottom line, Sarah, he's home. He's still continuing with his chemotherapy. He's got one lung, but his other lung is perfectly fine. And he survived
Wow.
from just getting outside. And it really, I had no idea that the sun could be that powerful, that it would actually take somebody that far gone and actually turn them around. And so I've become emboldened in
Mhm.
really trying to get this story out as much as possible. Obviously, this one story is anecdotal. It doesn't prove that sunlight is beneficial. I came to that conclusion months ago, years ago, when I saw the data that showed that fact sunlight is beneficial. This is simply the latest case story that shows that we can actually do this in patients who are that sick.
Wow. I love the story, and I know I definitely want to chat with her and share this with my community as well, because it's just terrifying to see your child in that sort of a position. I can only imagine. And then have something, it's his wish, like inherently he said, I've got to get outside, and it
Yeah.
ended up making such a huge difference. And yeah,
Yeah. Imagine
yeah,
if you would have asked to play, roadblocks
video games,
instead.
video game. Yeah,
Yeah.
exactly. Yeah. Wow. One more thing, because you are a traditional physician, a lot of the doctors I talk to are kind of alternative. You are still there in the trenches.
Yeah.
UV light and our modern dermatology, I still get comments daily of like, there's no safe sun exposure. You're preaching something that's going to kill people. You're going to give everyone cancer with your sunlight story. And so maybe we can just delve into that just a little bit.
Yeah.
Yeah.
Well, There's a UK dermatologist by the name of Richard Weller who published a paper in the Investigative Journal of Dermatology. And the title of his editorial is, and he backs it up with scientific research, obviously. He's a outstanding world-class dermatologist who's published. The title of his editorial is Sunlight, Time for a Rethink. And
Mm,
and that tells you where we are. Multiple large data sets, whether we want to go to the southern Sweden study, where 30,000 Swedish women were followed over 20 years, looking at, sun avoidance behavior, moderate sun exposure to avid sun exposure, and showing in that cohort that women who stayed inside and didn't smoke had the same mortality as women who went outside and smoked. So in other words, we're talking about the magnitude of evidence here is on the par with smoking. Okay, that
mm,
was done in 2016, that was published. A study that was published just literally 2 months ago, another UK Biobank study, 10 times the number of patients, 300,000 men and women, showing exactly the same results.
wow.
Okay, so obviously there's something different here. Again, it's a reductionist view. So what happened? We have a couple of studies. We have studies that show that ultraviolet light that is put onto skin cells, either in vitro or in vivo, increases the risk of skin carcinoma.
Right.
Okay, that wasn't done. Obviously, so the question is so therefore, does anything that has ultraviolet light in it, is it going to behave identical as when there is near infrared as when there's not near infrared? So we
Right.
already
Where's
know that near infrared has a positive impact in terms of the metabolic health of your skin.
mm-hmm.
So again, I don't think that that's something that we can take into consideration when we
Hmm.
say that going out into the sun is almost certainly going to cause a detriment. In that study, the Southern Sweden study and the Biobank study, all-cause mortality from cancer went down with sunlight exposure.
Yep.
So I think Richard Weller is absolutely correct. Dermatologist published in one of the main flagship organs of the specialty of dermatology saying, look, we need to rethink this.
Mm-hmm.
Maybe I'm not telling you, and he's certainly not, to go out there for 5, 6, 7, 8,
No,
sunbathe 12 hours a day.
no,
What we're talking
no.
about here is getting outside for 15 to 20 minutes to 30 minutes a day to make sure you're getting good sunlight exposure.
Yeah. And that's why I have the app I just created that has a little timer that can tell you based on your skin type, UV index, cloud cover, how much clothing you're wearing that okay, this is a good gauge to say you can, avoid the risk of overexposure. And usually on that little timer, it's like 15 minutes per side.
Yeah,
It'll tell you. And as we discussed earlier, there's so many benefits from just being in the shade, right? You don't even necessarily have to be in that
absolutely.
direct UV, strong UV, especially if you're super fair skinned or you're just scared from all the stuff you've been hearing your whole life. You
There's a
can
middle
get,
ground here. There's a middle
yeah,
ground. Put
right,
on long sleeves, put on a broad-rimmed
right,
hat. Do whatever
right.
the dermatologist tells you to do because the beneficial near infrared light from the sun is still going to be beneficial so long as you're doing that stuff outside.
Yep, absolutely. I love it. Well, is there anything that I didn't ask you that you think is really important for my listeners to understand, kind of in the framework of everything we've talked about today?
A lot of times I get asked this question, if melatonin's so good, should we just take it? And
Ah, yeah.
that's a big one. I don't know what your opinion is on it, but I think that melatonin at night is sort of the supplement to what really should be going on during the day. The problems that we have from a sleep
Mhm.
medicine standpoint is that taking supplemental melatonin can actually reduce your ability to sleep, especially at high doses. And some
Oh,
people tend
really?
to ramp up on that dose of melatonin. So past 5, 6 milligrams of melatonin, people actually find it more difficult to fall asleep. The other aspect
Interesting.
of it as well is that, at least in the United States, melatonin is not regulated. So if you're going to go out and purchase melatonin, and sometimes I ask people to do that if they're going to be jet lagged. There's a really good video that we've done on our MedCram channel on how to just completely crush jet lag so that you don't experience jet lag at all, pretty much. And it involves taking some supplemental melatonin at the right time of day. depending on whether you're going east or whether you're going west. And so make sure that it's actually checked out by a third party to make sure that there really is melatonin in that
Mhm.
supplement.
Yeah, because you can get like these ridiculous high amounts of melatonin because it
Yeah.
isn't. Yeah, and that is one thing I definitely get asked about a lot, and I haven't been able to find any data that shows taking melatonin because I've looked at a lot of writers' work that taking melatonin actually stops the endogenous production of pineal melatonin. But you're saying essentially there is a point where that can happen, or did
No,
I
it's
interpret
not
that?
necessarily down regulating the amount of melatonin that's produced by the pineal gland. They're saying is that too much melatonin, for some unknown reason, one of the side effects of this is that people don't have good sleep. They become more irritated, actually.
Okay. 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 What about people who take just I'm just selfishly asking because when I was trying to get pregnant, I was looking at this research about melatonin and fertility and how it could improve egg quality. And so I found out at that time, because I've never really taken it, but I found out at that time that I am so sensitive to melatonin. It gives me like the worst nightmares to the point where I'm like, okay, I can't handle this. So I'm curious if that's just like a one off or if you ever hear that from people that melatonin just gives them ridiculous nightmares.
I have not heard that. The
Okay.
one place that I will use melatonin clinically in patients is those rare patients that have something called REM behavior disorder. This
Oh,
is a
okay.
situation where they're not paralyzed during REM sleep. They actually do act out their dreams. It could be very dangerous.
Oh,
You know, it
yeah.
kind of sounds funny at the beginning, but realizing that people can be going through glass doors, falling out
Hmm.
of balconies on the second floor. This is a situation where their brain, for whatever reason, is not paralyzing them during REM sleep, which it should be doing. And for
Hmm.
those patients, actually, melatonin has been shown to be effective.
Okay. Yeah, I think that's really interesting. And I'm somebody who's never like absolutely not. And I always want to have a nuanced conversation about things. And like I said, with the whole melatonin supplementation,
Yeah,
my thing, and I don't know how you feel about this, is that people are not allowing their body to tap into their own endogenous production. Number one, they're indoors 90% of the day, so they're not getting any of the subcellular melatonin. And then at night, they're on the phone, on the TV,
right.
they have the overhead lights on, and so they're not, and it's too bright. Lux needs to be 10 and below that 3 hours before bedtime, and Lux should be 1 and below in the sleeping environment. And people aren't doing any of that. And so
Right.
before
And
we
so
jump on supplements,
here's what happens, and this is again reductionism. So we do a little bit of research and we find out that melatonin goes away at night when you expose your eyes to light, but we
right,
don't know what else happens. And then
right,
we find out that that you get vitamin D from the sun, and vitamin D has all these
right.
benefits. So what people decide to do is they're going to biohack themselves. They're going to say, I
Mhm,
don't want to go out in the sun. I'm going to avoid the sun so because I don't want skin cancer and I want to have a nice complexion. So I'll just take
mhm,
vitamin D to supplement for that, not realizing that there's 101 other benefits from the sunlight other than vitamin D production. And then the same
mhm.
thing at night is that not realizing that there's probably 101 other benefits from shutting down your light at night, getting the benefits of circadian rhythm and sleep more than just melatonin. And so
Yep.
they're just fooling themselves.
Yep. I agree. Yeah, we can't take a reductionist like we've talked about already with the vitamin E and the lung cancer patients and vitamin
Yeah.
A. And it's like we're not that smart. And when we look at light, we've done the same thing indoors. Like we just have these, 5,600, 700, 6,000 Kelvin bulbs, but the lux is probably, you know, a 80 or 100. There's no infrared. And so I always say light is a nutrient. You've got the frequency, you've got lux, you've got all these other aspects, you've got Kelvin involved in there as well. And we just take out one piece of it, blast us with blue light, and wonder, why we don't feel well. And then there's the implication of flicker, which is a whole other
Yeah.
topic.
Yeah, that's another topic that
Yeah.
Scott Zimmerman probably educated on all of us.
Yep.
Yeah.
Yeah, I think he has a converter now for his Nera bulbs
Yes.
that take it
Yep,
from
and
the
they're going to be
Kelvin.
they're probably going to be doing some research on that to see. I know the guys over there in UCL, University College London, like Bob Fosbury and Glenn Jeffrey, who you're going to have on. he's a great guest to have on because he explains things so well. And really, a lot of the work is being done in his lab, as well as about 20 to 30 other labs across the world that are really looking at this idea that light can impact our body.
Yes. Yeah. The blue light and the metabolism, making the blood sugar and the insulin and the cortisol go up. And that's without any food. And yeah, it's the more of us talking about this and researching it and implementing it with people, I think the better, because yeah, you people start doing it and they're like, oh my gosh, I feel such a huge difference. And
Yeah.
then they tell others. And I think it's just
Yeah.
so important that these conversations happen. And I just can't thank you enough for coming on and talking with my community. And if people wanted to find you, what would be the
Yeah.
best way to find your information?
So MedCram is the name of our company. MedCram.com is our website on the internet that does continuing medical education for healthcare providers. Or if you just want to follow us on YouTube, we're there, MedCram videos. I'm also personally on Twitter as well as MedCram.
Awesome. Well, I'll make sure I have all that linked in the show notes. And yeah, thank you so much for being here. It's just been a really wonderful conversation.
Thank you so much, Sarah. Appreciate it.
Thank you so much for listening to the Evolving Wellness Podcast. Just a quick little reminder, this is not medical advice nor meant to be taken as a substitute for working one-on-one with a healthcare practitioner. And if you enjoy the show, please head on over to Apple or Spotify to leave the show up to a 5-star review. If you're over on YouTube, please leave us a like, leave us a comment. I really appreciate you for being here, for listening to the show, and your support means the world to me as I continue to try to pull guests from around the world to bring you informative content to empower you to make decisions about your own health. Thank you so much for being here, and I look forward to seeing you again next week.